Now, I don't like to, outline taken against, I like to, steps are taken against the Omicron variant. Vaccinations are obviously the most we're doing, but they're the only important thing. First, masking. Masking is an important tool to control the spread of COVID-19. And when you're indoors in public places, you should wear the mask. And there are a lot, lots of masks out there. And the Centers for Disease Control and Prevention says that wearing a well-fitting mask of any of them not wearing a mask, it was well-fitting, over your nose. But it's about one report, they don't wear a mask. As I've said in the last 2 years, please wear a mask. If you're, I think it's part of your patriotic duty. It's a pain in the neck. I've taken every action I can as president to require people in federal buildings and on airplanes and trains because they cross state lines. I've made sure that our doctors and nurses and first responders have the need. Never again we're going to have our nurse-made masks in garbage bags over their clothing for hospitals because they don't have the gowns. We tripled our stockpile. Specialized N95 mask office. This is going to make sure that there will be an ample supply of healthcare workers and first responders. We also have helped make sure that high-quality masks are widely available in ample supply at places, sold online and in stores. But I know that for the mask is not always affordable, convenient to get. So, we'll announce high-quality masks available to the American people for free. I know we all wish that we could finally be done with wearing masks, but they're a really important tool to stop the spread of highly transmittable Omicron variant. So please wear the mask. Second, we're seeing real improvement in testing. When I got here, we were doing fewer than 2 million tests a day. And it's changed. None of these tests were at home. Or this month, it's estimated that we will hit approximately 15 million tests a day, and we'll have over 375 million at-home rapid tests in January alone. That's a huge leap. We've steps including invoking the Defense Production Act as early as last February to ramp up production. And we're on track. We'll roll out a website next week where you can ship home. And in addition to the 500 million tests that are in the process of being acquired to ship to you homes for today, directing my team to procure an additional 100 million more tests to distribute for free. That means 1 billion tests in total to meet future. And we'll continue to work with the retailers and online retail to increase availability. If we want an immediate test, we continue to add fees so that there are more free in-person testing sites. For those of you with insurance, you can get reimbursed for 8. For those without insurance, we have 8,000 free testing sites. There's testing sites for you by Googling COVID test near me. Google COVID test near me. And to help lead our federal testing program, I've tapped Dr. Tom, I hope I pronounced it, Inglesby, Jeff, and those leading infectious disease experts, and I'm grateful for his willingness to help tackle this challenge. Third thing, today we'll discuss our hospital response efforts. Just since Thanksgiving, 100 military and other federal emergency personnel have been deployed to 4 states, tribes, and territories, including over 350 military doctors, nurses, and medics, helping short supply. This is on top of more than 15,000 National Guard members that are activated in 49 states. These deployments in my direction, and thanks to the American Rescue, fully paid for by the federal government. We've shipped over 5 million pieces of personal equipment, gloves, gown, masks, to protect frontline healthcare. We're shipping more treatments of COVID-19, which includes than at any point during this pandemic. In addition, I've directed FEMA to work during the District of Columbia to make sure they have enough hospital bed capacity. Today, I'm announcing our next deployment of 6 additional federal medical teams, a total of more than 100 medical personnel, to 6 hard-hit states: Michigan, New York, New Jersey, Ohio. And let me close with this. It's been a long road, but what's clear is when everybody does their part, no matter where you live, no matter your political party, we've got to fight this together. Unfortunately, stepping up, as they always do, there are others sitting on the sidelines and standing in the way. If you haven't gotten back to it, personal choice impacts us all, our hospitals, our country. I make a special appeal to social media companies and media outlets, the misinformation and disinformation that's on your shows. COVID-19 is one of the most formidable enemies America has ever faced. We've got to work together, not against each other. We're America. We can do this. So the ground, thank you for all and everything you're doing. And I'll stop here so we can get to the briefing started. Thank you.